Appendicitis happens when the base of the appendix gets clogged up. And basically it kind of can't drain. It drains into the colon typically. Usually gets clogged up by lymphatic tissue. For instance, in the youngsters, they get a cold or a virus. Sometimes it's a little pellet of poop that gets stuck in there, and that clogs it up. Every once in a while it could be a tumor. People will usually complain of either feeling constipated or potentially a little diarrhea. They generally have a low-grade temperature, not very high, not usually higher than 101, somewhere between 99.5 to a little over 100. They can feel chilled, not hungry, bloated. People usually reach a point where the pain hasn't gone away. It typically will rupture from about 72 hours from onset of symptoms. We like people to come as soon as the pain's constant, and it doesn't wax and wane. It starts and it doesn't stop. So if it's waxing and waning, it's usually not appendicitis. So it starts as a generalized discomfort, so we call it periumbilical, kind of right around the belly button. And then as time goes by, some people call it migrating, it doesn't really migrate, but it localizes, becomes very specific to the right side of the tummy. So if you put your thumb in your belly button and your finger on your hip bone and drop your finger down, that's where the appendix lives. If you have appendicitis, in virtually all cases, the appendix needs to come out. We like to get it out before it ruptures. After that, things get a little more complicated. People get a lot sicker, and they can even get sepsis. When they come in, we usually check their, vital signs and some blood tests. Their infection count's usually a little elevated. These days, almost everybody gets a CAT scan. The CAT scan usually answers the question. As long as it's early appendicitis, meaning it hasn't been there for longer than, 3 days or so, we can take people to surgery. That's really the best treatment. There's been some trials of just giving people antibiotic therapy, but people who just get antibiotic therapy for appendicitis have a longer recovery. About 2/3 of them are going to require surgery anyway. It's more expensive, and so it's just better in people who are well enough to have surgery, just get the appendix out. If people come 2 weeks after the appendix ruptures, it's a different cup of tea, right? You have to give them antibiotics, maybe place a drain, let them heal, and take it out 6 weeks later because it blows up and you can't even really find it. But early on, yeah, we're going to take it and get your appendix out. Almost all those people go home the same day of surgery.